Hello, everyone, and welcome to the 2% Better Health podcast. I am your host, Carrie Bennett, and I am so excited today to get to talk to Dr. Michael Twyman. Dr. Twyman is a board-certified cardiologist in St. Louis, Missouri, and he you're expanding your practice, or you're changing, actually, your office setting. I've been following it on Instagram, and I know that launch is happening very soon, so I'm kind of excited to see, but you do a very integrative approach to your cardiology. So I'm really excited today to chat with you about how we can kind of look at the cardiovascular system, maybe outside of the box, from the quantum realm to other aspects of it. So welcome, and thank you so much for joining us.
Well, thank you for having me. This is going to be a lot of fun.
Super pumped. But first off, how did you get into cardiology? I'm curious, like, what made you specialize in that? Is there a story behind that, or?
So I did all my medical training at St. Louis University School of Medicine, and did basically 10 years of training after college. And at some point, you're exposed to, the different specialties in medical school, so you kind of try them all on. And I like doing certain procedures, but didn't want to be in the OR, the cath lab all day long. I like certain radiology procedures, but didn't want to be in dark rooms all day long. And I didn't want to be in the hospital all day long. I like to see some outpatients and such. So cardiology was a good mix because you could do a little bit of each of that each day, and no day was the same. And the cardiovascular system was just, fascinating to me, how it, all kind of came together. I was a math major in college, so a lot of cardiology, especially when you're in the ICU, is very numbers focused. So you can look at somebody and make tweaks and turns on the dials and make things better, by the numbers. And so I did that for many years, and I've treated way too many heart attacks and strokes in my life, and I thought, like, maybe there's a better way to prevent the Humpty Dumptys from falling off the wall in the first place. So a couple of years ago, started my own practice, and now really look at health at a different angle. And I stumbled upon the quantum world a few years ago, and really kind of went deep down the rabbit hole on that.
Yeah, so obviously I found you through quantum health, through the quantum world. So I don't think a lot of people make the connection between how quantum physics, quantum biology can impact the cardiovascular system and cardiovascular health. So where would you start with someone who's just mind blown by that statement?
Yeah, I mean, I definitely was. And, I was, like I said, a math major in college. I was actually going towards a double major. I was, majoring in physics at that time. And I actually got far enough to get through quantum physics. And at that point, I really didn't understand it. I remember the first day of class, the two instructors stood in front of us and said that, there's maybe about like 5 or 10 guys in the world that really understand this. And we're not 2 of those guys, but we're going to teach you the best we can. And I remember, like, oh, that's really interesting. But then, I went down the biology side, for many years in medicine, and then stumbled upon, the work of other quantum pioneers. I realized, how important the mitochondria actually were, and that it was all quantized. And so then I kind of retaught myself a lot of stuff I had forgotten since college. But if you really think about the mitochondria being more than just the, energy powerhouse of the cell, and how the world actually, works with light, water, magnetism, you start figuring out, like, okay, it's a lot simpler than, has to be. I mean, you don't really have to understand spin state and all that stuff. You just have to understand that it's not all about biology.
Right. So for those who are unfamiliar, I guess people who have listened into this podcast have heard the word mitochondria enough, right? They kind of know that I go a little bit more towards the nerd realm side of things. But the inputs in the mitochondria are really important when it comes to understanding this connection. So just talk with me. What makes those mitochondria tick? How do you view them, and how do you optimize them, just at the most basic level?
So I usually talk about it with the patients that, the mitochondria, yes, they're the powerhouse of the cells. They do a lot of other things other than just make energy for you, but you have to really mind your mitochondria if you want to have optimal health. And your mitochondria are your sensors to the environment. Your heart is a muscle. We'll get into probably, more than it being just a pump, but, the heart is a muscle, has a lot of mitochondria. Your mitochondria are mostly in your brain, heart, and your immune system. And I've seen some estimates that, your heart by weight is about 1/3 mitochondria. And so I spent so many years looking at, heart disease, especially congestive heart failure, as a problem with the pump. The pump wasn't squeezing well enough, or wasn't relaxing well enough. And we would give certain medicines to make the heart squeeze better. And I never really put 2 and 2 together during those days that it was really a kind of acute or chronic failure of the mitochondria to produce energy, produce, easy water. And now that I kind of understand that, like, oh, okay, if we look at, the heart as a mitochondrial organ, what can you do to improve that? Light, water, magnetism. So get your light environments right, I know you're an expert in water. I'll probably actually defer to you to answer most of those questions.
Sure, sure.
And then the magnetism, you did an outstanding podcast on earth and grounding. So I would just say, reference back to that one if you really want to know how, magnetism works in the heart.
I appreciate that. And I love the statement though about I think we're taught back, I don't know, maybe when did I dissect a frog? Maybe in the 4th grade, right? And you look at the heart, and the heart is always synonymous with a pump. It is supposedly what moves the blood. It's all its job is just to squeeze blood through the body to get to everywhere it needs to go. And are you familiar with Dr. Tom Cowan?
I know of him, but I haven't extensively read his work.
I just watched a short little video back in the day about the heart potentially not being a pump, and it really got me thinking. And then you referenced the same thing. So if the heart's not a pump, then what's its role? Or let's talk about blood circulation. Let's geek out about that a little bit, because I like to view the heart and the cardiovascular system as an electrical system. And I think that really throws people off, because they're assuming that the only electrical system we have in the body is our nervous system, right? We know about nervous system impulses, but I am a firm believer that our blood ferries electricity through our body. What's your take on that?
Well, many people have probably had an electrocardiogram or EKG done before. They put a bunch of stickers on your chest, and they press a button, and a little squiggly line show up on a piece of paper. And I spent years, interpreting electrocardiograms, but it's only been the past couple of years that you really think about, like, well, where does that electricity come from? And the electricity is coming from the mitochondria in your heart. We frequently kind of joke in the cardiology world that there's, plumber, those are the guys that go in there and fix blockages in your heart with stents. And then there's electricians, those are the electrophysiologists that are, ablating tissue that, is sending off abnormal heart rhythms, or they're putting in pacemakers or defibrillators to kind of, rewire the system. So, I've, done hundreds or thousands of heart catheterizations and procedures in my career. I'm no longer doing those, to focus more on the prevention side of things. But if the heart is pumping out like 4 liters a minute of blood, and you got I've seen upwards of 60,000 miles of blood vessels, it really doesn't fully make sense that how a pump the size of your fist is really pumping blood through 60,000 miles of blood vessels, and it's continuously going. It has to be something else that's in the blood that's actually helping propel the blood through the system.
100%, especially when you look at the capillaries and how tiny they are compared to the red blood cells. And it's like, nature's not stupid. Why would you make something smaller? Why would you make the capillary smaller than the size of the red blood cell unless there was a specific purpose for that? And so I don't know, I'll get your take on this, but I do believe that at that point is where the red blood cell is shedding a bunch of negative charge at its target location. And that negative charge then is picked up by our cells, picked up by the mitochondria even, as either one way just to sense what's going on in the body or in the environment, or actually to give the cells part of the negative charge that they need to function their best.
That's well said. I don't think I can say it any better than that.
Perfect. No, that's cool. So then let's talk. When it comes to getting this negative charge, what are things that you're recommending to patients?
I mean, it just starts with nature. We all get stuck inside too much of the time. We're disconnected from the earth. We're disconnected from, sunlight. To understand the real deep quantum physics and how this all works is super complicated. And I don't pretend to be an expert in it, but how you actually implement it in your day-to-day life, I think I'm pretty good at that. Where I can read these really complex things, I can listen to all these podcasts and distill it down, and then be able to tell my patients, this is what you have to do. And then if they want to ask the questions like, well, why exactly does it do this? Then I can kind of geek out with them. But, just they got to get their light environments right first. And it's, it's pretty straightforward. It's like, live outside more. When you're inside, protect your eyes with, from artificial light. Yes, there's apps on your phones and computers that can dial down the blue light, but it's not enough. If you're a sick person, if you're sick, you got to be hardcore. You got to have your indoor sunglasses all the time. And as light changes throughout the day, you got to change the different light that's entering your eyes throughout the day. So these are the kind of the day pair that are going to at least be somewhat yellow and blocking up to at least 450 nanometers of light. And then in the evening, you want to block up to 550 nanometers. So your lenses are going to be a little bit more red at nighttime. So, start with the light. And then, I know, like I said, we said earlier, you're a pretty expert in the water. That one's usually easily understood. It's the magnetism. I think a lot of people get tripped up on, but, you just tell people get away from your electronics, especially when you're sleeping, and go outside barefoot. It's not too hard.
Right. I think I heard you in one of your lives refer to the magnetic field of the heart, and how there's the potential, it extends really far. So I'll let you maybe go into detail about that, but that's, if we can think of the heart as not just being this physical organ that's inside of us, but instead it actually extends out a ways, it's easier to understand how interference can happen.
For sure. I mean, I've seen reports that, the electrical and magnetic fields kind of, I should say magnetic fields really kind of radiate out, like 20 some odd feet from your body. And an interesting way to think about it is that, like, is that the reason why, certain people, when you're in the room with, you gel with them, or you just are literally repelled from them? I mean, I assume it has to be that. And, there's certain people that are just, your mitochondria being the sensors to the environment. You frequently see people with, shirt pockets that got, they got their phone dipping down into their pocket. They should not be surprised when they're having palpitations or abnormal heart rhythm sensations. You put basically a radar jammer, right over your sensors. So I think people just need to be aware that their environment, is impacting their heart health.
I think that's great, because I do have I have clients who are definitely working on they want to get to the bottom of, like, why did I get that AFib right then? Or why was I feeling dizzy? And they're turning to things like, well, what was my blood sugar like? Or what did I eat? And I think it's important to look into those sorts of things, diet and exercise. I think those are important aspects, but I have seen immediate change in a client who is experiencing what they perceived as, atrial fibrillation, go barefoot on the grass for about 5 minutes, and everything just completely calmed down for them. And so who knows, was it a placebo effect? Maybe, maybe not, but I am more towards the leaning of, you have to set your environment right. You need the electrical and magnetic inputs to be ideal if you want the electric and magnetic functioning of the body to be ideal.
100%. And, atrial fibrillation, for those that don't know, is just an abnormal heart rhythm where the atria, the top chamber of the heart, really just starts beating very irregularly, 300-400 beats a minute. And the bottom chamber of the heart can't keep up. The heart will not pump that effectively at that rate, and you'll pass out or die if it keeps going that fast. If the bottom chamber of the ventricle is beating that fast. And the major risk of atrial fibrillation is that atria is just kind of quivering. Blood can coagulate or clot in it, and then if that clot breaks free, depending where it goes, causes stroke. So that's the major risk of atrial fibrillation. But many times atrial fibrillation is driven by inflammation. And inflammation has hundreds of causes, but the more inflammation there is, the atria sense that inflammation, and atrial fibrillation, fires off. And, earthing and grounding is excellent at lowering inflammation. You lower inflammation, there's a plausible reason why they'd have less atrial fibrillation.
And you also then allow the blood flow with those electrons, you allow that blood flow to be that much easier, right?
Right.
Sunlight. Okay, so let's talk there for a second, because for a long time, I guess I would say for the past, I've been doing this for about 15 years. And I would say 15 years ago, when I was talking to clients about total cholesterol, because they were coming in super concerned with total cholesterol, it's like, well, ask your doctor about, these other things, like, triglycerides, HDL, Now we're starting to get away from just the total cholesterol, but we're still really focused on like 4 different numbers.
Mm-hmm.
So I would love it, because I don't think it's everyone's really aware. What should we be looking at when it comes to cholesterol? What's more important? I know your office does some pretty awesome testing that I'd love for people to know about. I think it's an important thing to assess besides just your total cholesterol. So where do you want to go with that?
So to start off with that, what is cholesterol? I think many people, thought that, even many physicians say, your cholesterol is high, we need to lower it. I mean, that's a little bit too simplistic. Cholesterol is a waxy substance, it's like oil and vinegar. So it can't float in your blood by itself. So it gets wrapped up in something called the lipoprotein. So the lipoproteins are essentially like cars or boats that ferry the cholesterol around the system. So cholesterol is needed in every cell in your body. Without cholesterol, you're dead. So Mother Nature or God or whatever you believe in didn't put cholesterol in you to give you a heart attack. So cholesterol is a repair mechanism. You make your cell membranes with it. You make your bile acids to digest your fats. You make your sex hormones from it. So no cholesterol, you're dead. But cholesterol can't, get to where it needs to go because it's not soluble in blood or plasma. So these lipid proteins get made in the liver. They wrap up the cholesterol, and it also wraps up triglycerides, which is the main thing that the lipoproteins are ferrying around the system. Your body needs energy. And I know there's other sources of energy, but for foodstuffs that get broken down into triglycerides, the liver pumps this stuff out. The cells that need energy put out a little receptor, they bind to it, they download the triglycerides that they need for energy, and they move on, the fatty acids, and they beta oxidize it. So, just looking at cholesterol is like looking at, passengers inside of a ferry boat. It's an interesting number and you need to know that, but what causes a traffic jam in your arteries? It's how many boats are floating around in the rivers going through your system. So particles predict risk. So, the traditional cholesterol profile has, 4 numbers, as you were saying. There's a total cholesterol, there's an HDL cholesterol, a triglyceride, and usually it's a calculated LDL cholesterol, LDLC. So the way to think about these, numbers is that before they were able to use the new techniques, they would just take your blood, they'd spin it down real hard, and they would look at the different fractions, and the denser stuff floated to the bottom. That's the high density lipoprotein, the middle stuff, and then, the serum at the top. And it was basically, they just took all your cells, they broke them, all the cholesterol spilled out, and they looked at it, as it got separated. And so, that was the best they could do at that time. Now they can actually tell you like what is ferrying these cholesterol and triglycerides around. And those are LDL particles. And you can also measure what's known as an ApoB. The ApoB is essentially the protein that sits on top of the particle. So if you think of a tennis ball being what fills up all the cholesterol and the triglycerides, the little white stripe on the outside of a tennis ball, would that be the apolipoprotein B protein? And that protein gives it structure, but also some of that acts as like the lock and key. So when that little particle is going through the system, a receptor binds that ApoB, and then it downloads what's inside the particle and gets out what it needs. So you can easily test that at, some major labs. And, an ApoB number is the number one lipid number that you'd want to know for risk, because sterols, are always present in plaque. So cholesterol is going to be present in plaque, but there's 300 to 400 different things that potentially are dinging up, damaging the arteries and causing that plaque to form. So, it's kind of like shots on goal. The more ApoBs, more likely some of them are going to get through the walls of the artery and start getting retained there.
And so then not only does various aspects in terms of cholesterol come into play, but so does the health of the endothelium, the health of the arteries, because if that is a nice slick surface and a nice uninflamed surface for these particles to bounce off of, right, then we're less likely to potentially create some sort of I don't know, what would you refer to that? Would that be the plaque right there? Would that be if stuff starts to stick?
Correct. So, like I said, I'd listened to your other talk on nitric oxide, which was excellent. The endothelium is the inner lining of your artery. So if your arteries are like a garden hose, where the blood is flowing is the lumen, and then the walls of the artery are supposed to be a certain thickness. There's the intima, the media, and adventitia. But the intima, has a coating called the endothelium. The endothelium is 1 cell thick. And if you stretched out all your endothelium out of your 60,000 miles of blood vessels, the surface area is supposed to be about 6 tennis courts. Wow. And it's your largest secretory organ. It secretes many things, but one of the major things is it's secreting nitric oxide. Nitric oxide does many things, but for the vesicles, it does 2 things. It causes the smooth muscle in the artery to relax. So the artery gets bigger, flow improves. And if you have high blood pressure, you likely have an issue with the way nitric oxide is getting released. And then the other things it does, it somewhat acts like Teflon so that things don't stick to the endothelium in the first place. So, these little ferry boats are floating through your lumen full of cholesterol and triglycerides. As long as they don't stick to the endothelium, like Velcro, they're not going to necessarily cause a problem. It's when they start sticking to the endothelium and start getting retained under the endothelium, well, then it starts swelling and the intima starts getting thicker. Once that starts happening, then your immune system gets activated. Your body thinks it's under attack from an infection, and these monocytes and mast cells and everything starts investigating like what's going on. Why is this artery starting to deposit these lipid particles into me? And then the immune system turns on, and then if you don't shut the immune system off at that point, then the plaque starts developing, and the plaque can just slowly grow over time like a little dormant volcano or pimple on the wall of the artery, and then eventually it just pops, and then it pops and spills out all this damaged cholesterol and different immune modulating material, and then a blood clot forms because your body thinks it's bleeding. That blood clot then blocks all the blood flow downstream, and the tissue downstream, it becomes ischemic, doesn't get enough oxygen or nutrients, and starts dying. So that's what an actual heart attack or stroke is. It's not that your arteries are sewer pipes and they just slowly fill up and now they're 100% blocked up with sludge and you have a heart attack. It's no, the walls of the arteries are, getting damaged over long periods of time usually, and you generally have no symptoms about half the time before one of these little plaques rupture, and they rupture, then the whole cascade of a heart attack and stroke, kicks off. So, there's definitely different tests you can look at to assess the health of the endothelium. And if you have healthy endothelium and high cholesterol, does it matter as much? Probably not. But if you have bad endothelium and high cholesterol particles, you're much more likely to be retaining those particles in the endothelium.
That's a great point. So I was also listening to a case study you did of someone who was probably someone who's close to my age on a ketogenic diet, right? Thinking like, okay, that's healthy, but then he came in with super interesting lipid numbers, high total cholesterol, I believe. I believe he also had high HDL, but really high HDL, I would say, but decent triglycerides. And the fact that you have other tests to assess the health of the endothelium made a difference in terms of your recommendations for him, whether or not this nutrition plan was appropriate for him, because that was not enough information for you to say yes or no, this was working for him. So what I know you then did was you did your 3 beautiful tests, I believe, or maybe even more, that show that the inside of his blood vessels were not necessarily handling that high fat the best. They were already inflamed, already showing some signs of plaque buildup. And so you made some recommendations for him, and I do know in one of the lives I think someone was like, or someone asked you, or maybe you just talked about, well, what if we had sunshine to the mix? Could that have an effect on clearing some of that cholesterol from the blood? I know it would have an effect on building exclusion zone water in the blood vessel, right? So you'd add that slick coating to the blood vessel, that protective coating to the blood vessels. I'm even thinking that we do know that sunlight in the mitochondria takes cholesterol and makes pregnenolone. And so I'm wondering if there's a way that we would be able to use that cholesterol so it's not just staying in the bloodstream, if we were to really truly say, okay, yes, what if we gave this particular person a test to say, okay, for 1 month, 2 months, however long it might take, you have to practice ketosis plus sunshine. And if you do ketosis plus sunshine, that may have an effect. What are your thoughts on that?
It's a great, interesting kind of a thought experiment. And it's one of those things that's test, don't guess. I mean, biohacking or health optimization is all about getting a baseline set of data, doing whatever intervention you do, and then retest. I frequently get asked, is a keto diet healthy? And like, it depends, where do you live in the world? What are your mitochondria doing at this time?
Right.
What is your ApoE status? That sometimes has, function of how you're going to digest fats. I mean, cholesterol metabolism is actually extremely complicated. I mean, it's, there's a 37-step process on how you build cholesterol in the liver, and you essentially have 3 pools of cholesterol. Your brain's pool of cholesterol is completely separate from the vascular systems. And then your cells, other than like your adrenals and your gonads, for the most part, they make all their own cholesterol. They don't need cholesterol to be made in your liver and delivered to them. When the body's under a lot of stress, then the LDL particles and the HDL particles will deliver cholesterol to the gonads and such, and the adrenals to make, your other sex hormones. But for the most part, they don't need that. So what's actually floating in your blood vessels is mostly to deliver energy to the cells downstream. And so, if you're putting in more dietary cholesterol or dietary fats or even tons of sugar, your body will respond in kind by packaging up the energy and make more particles. And so then if you eat really clean for a while and your lipids, quote, improve, well, the second you stop doing that, you're going to have a natural kind of homeostatic set point. Your body's going to go back to where it normally wants to be. The only thing we're really trying to prevent is, that sterol getting deposited into the walls of the artery. And that generally is going to require some type of inflammation leading to endothelial dysfunction. So go looking at those things. You have a lot of inflammation or endothelial dysfunction, then you get a little bit more concerned about what's being ferried around in the blood vessels. But I do get that question asked, like, well, what if I got a lot of sunlight and try to convert it all into vitamin D? I'm like, I don't, you have, I think 30 to 40, I don't misquote it, but I think it's like 30 to 40 grams, of cholesterol in all your cells. I don't think it would matter that much if you just laid outside in the sun all day and baked, that you're going to be able to make that much vitamin D to make a difference in your blood plasma of cholesterol. I mean, it'd be interesting thought experiment to see how much it would happen, but I don't think it would make a big deal.
Fair enough. No, that's completely legit. So then in terms of this inflammation, are there certain biomarkers that you can test in the blood that you like, or do you just go straight for those other tests that you do at Apollo?
So there's a few kind of biomarkers that I will check. I mean, the one most people might be familiar with is HSCRP, high sensitivity CRP. So, protein made in the liver. It's a couple different cytokines, interleukins that kind of get, packaged up into this protein. And typically, inflammation from an infection is kind of quickly comes on and then slowly comes off. And so, you want your immune system turned on when you have an infection. You just don't want your immune system always turned on, because it's just more likely that the endothelium is going to get dinged in the process. So high sensitivity CRP, it's consistently well above 2. You need to go start looking for a cause for it. So, it can be, yes, it can always be nutrition, exercise, deficiencies, but sleep apnea, heavy metal exposure, there's so many things that can drive, inflammation. But the other kind of more vascular specific ones would be something called LPPLA2. It's also known as the plaque test. That one, when it's elevated, means that you have plaque in the body that's either trying to grow or trying to rupture. Myeloperoxidase is a good one too. That, that's what's basically inside white blood cells. That when you have an infection, your body goes and dumps this myeloperoxidase onto a virus or bacteria. It's basically like bleach, and you destroy it. But if you have a ton of myeloperoxidase in your vessels, it basically will destroy HDL, and then you'll have dysfunctional HDL. So you're gonna have, misnomer, there's no such thing as good cholesterol, but people have, high levels of HDL-C, and they think they're protected from vascular disease. But, if you have high HDL-C and you have high myeloperoxidase, your body's very inflamed, and that HDL-C is dysfunctional and not really doing its job. And it's actually probably delivering more, oxidized particle payloads to the arteries. So you don't want to have high myeloperoxidase long-term. Then the other one would be, there's one called F2 isoprostane over creatinine. It's a urine test. It's probably one of the better markers for oxidative stress. So, oxidation is happening, millions of times a second as you breathe in oxygen and, combust it in your mitochondria to make fuel. There's going to be smoke. There's going to be different reactive oxygen species made. But, if you, are out of balance and you're more oxidative than, stable, this urine test will be very elevated. And then another test I'd like to have is the urine microalbumin over creatinine. Typically, this is a test that diabetics or pre-diabetics would be familiar with. If this level is high, you're leaking protein into your urine, which protein is a big molecule. It's not supposed to be in your urine. So basically tells you have leaky endothelium to your kidneys. Well, if you have leaky endothelium to your kidneys, you're going to have it, going to your blood vessels, to your heart as well. And then one other test, that's more not necessarily inflammatory, but asymmetric dimethylarginine, ADMA, and SDMA, symmetric dimethylarginine. When these are abnormal, you're going to have, abnormal levels of nitric oxide. And, nitric oxide in the right places at the right time is a very key to cardiovascular health. So you start there, like, what is the body sensing in the environment, and how much inflammation is going on, and how much oxidation. I learned from Dr. Mark Houston many years ago, there's 300 to 400 different things that can drive vascular disease, but the body's only going to respond with 3 finite responses. It's going to respond with inflammation, it's going to respond with some type of oxidative force, or it's going to respond with an autoimmune dysregulation. You start attacking yourself. And so you can go looking to see, like, where are you on that spectrum? Inflammation, mostly high sensitivity CRP, oxidation. You can check oxidized LDL. There's a better test now called oxidized phospholipid on ApoB, but the urine test, that F2 isoprostane over creatinine, tells you pretty good what your oxidative stress is. And then a quick screen for your autoimmune status would be checking thyroid antibodies. If your thyroid is getting attacked, you have Hashimoto's or autoimmune thyroiditis, you're set up for other autoimmune conditions, and your blood vessels are ferrying all these different interleukins, and cytokines through the system. Blood vessels sometimes are the innocent bystanders, just getting damaged in the war that your immune system is doing with the rest of your body.
Sure. I've actually seen several clients with really elevated HDL, thinking that was, but also had a really active autoimmune condition going at the same time. And so it's kind of hard to label something as good or bad, but that's what everyone wants to do. Well, look at my good cholesterol is good. It's like, well, let's look at this in the bigger picture of what's going on in your body. But I do see that all the time, not all the time, just a handful of times, having that elevated HDL, like you were saying, not necessarily beneficial for the health of the endothelium. So if you see someone who is, I'm thinking we're divvying this up into two things, right? There is a ton of prevention that can be done, and that's where your specialty lies right now. That's what you really like to coach in your patients. And then there also is, okay, well, someone is already experiencing inflammation of the endothelium or plaque buildup. So can we just talk about someone who might be here first and just say, well, what are potential things that you look at, things that you recommend to patients who are like, oh crap, I do think I've got some plaque buildup in my arteries. Is it too late? Am I just doomed down this pathway? Does it just stay there then? And like you said, it doesn't sludge up the arteries, but what would you tell someone who already is experiencing some of that?
So, first, congratulate them for coming to see a, cardiologist years before they need the stent or bypass surgery. Sometimes I get, asked that question, why should I even see a cardiologist? Like, well, yes, I, was trained in cardiovascular disease, but, I'm trying to prevent you from going down the late stages of cardiovascular disease. And, I think it was excellent training that I had. I've seen, unfortunately, way too many people die early from cardiovascular disease. And so I understand the pathophysiology that leads you to the end game. And then you can reverse engineer, like, okay, if we do this 20 years, you won't end up this way. So, people testing early and finding they have a little bit of plaque, I tell them first, okay, we found it. The goal is to stabilize it. Don't let it get bigger. Don't let it get vulnerable. It's the self-inflamed plaque that tends to cause a problem. The hard calcified plaque tends not to cause the problem as much. So find out where they're at on that station. Are they, actively still laying down plaque? Well, if they have endothelial dysfunction, they have a thick intima, they have a lot of inflammation. Yeah, they're probably still building up that little volcano in the walls of the artery, and then trying to figure out what that lever is and shut that off. But no, it's definitely possible to at least arrest the atherosclerosis of the plaque so it doesn't get bigger and cause a problem. And then in the right cases, the body is smart enough, if you take away the insults, to let the plaque start regressing. It doesn't always make the artery go back to 100% normal, and that's not necessarily the whole goal. The whole goal is don't have a heart attack or stroke. Don't let those little plaques rupture. So tell them that, it is possible to find disease early and not have events, and, you tie them in back to nature. I think adding that on to just, what the traditional world of, well, here's your cholesterol lowering agent and here's, a bunch of supplements, sometimes those are tools that are needed, but you really get back into, Mother Nature, get their light environment, their circadian rhythms, dialed in, add some earth and grounding, and then, and then, definitely, you're going to talk about nutrition, exercise, because that, that's always their mindset that it has to be that, nutrition, exercise. Like, I'm not telling people it's not important, but you have to focus on the circadian rhythm stuff first. If you don't get your circadian rhythms dialed in, you don't get your sleep dialed in, I'm not going to say it doesn't matter what you eat, but it's not going to matter as much. You have to let your mitochondria repair themselves at night, and without sleep, you don't repair them. So I, usually joke sometimes that if I wasn't doing cardiology, I'd be doing, sleep medicine, because how important sleep is to your overall longevity and health span.
Well, and I have a feeling that what you coach is a side, better sleep is a side benefit. Simply when everything you coach, your patients probably come back like, wow, I'm sleeping a heck of a lot better. I'm getting into that deep sleep, and it has to do with that circadian rhythm. That's for sure. Have you, just out of curiosity, have you ever looked at live blood under a microscope?
I've not. I heard your explanation. It's fascinating. I mean, I've definitely seen pictures of, the red blood cells all kind of clumped together, and then, they do, some type of earthing, and then the blood is, more free flowing. I think it's fascinating. I'll have to kind of research and see if that's something I can potentially offer at some point.
I'd be curious. I feel like patient compliance, when they can see it, almost like, hey, okay, this is what your blood looks like now. Let's let you sit outside in our nice little, wherever park, barefoot for 30 minutes, and then to retest and see. And then if you can physically see that difference in terms of how much healthier those red blood cells look, and then you can make that connection with those red blood cells. Now they're repelling each other. They're full of this negative charge. They're delivering this energy to the cells, this negative charge. It's really, I think, a real-time way you can show people that they're charging up their batteries or charging their bodies in some way. So I was just curious on that. But so then we said that not all is doomed, right? We're here. You may have some plaque buildup. It's not all doom and gloom. But ideally, we're catching people in this preventative stage. So a lot of what you recommend transfers well beyond just cardiovascular health, right? This is just, I think the majority of your recommendations are just synonymous with how to be a healthy human. But I don't know, do you have a hierarchy besides like after circadian rhythm, getting your light right? Like, where do you prioritize other things? I know for me, grounding is creeping up quite a bit more and more. But what's your take on all the other things kind of along that preventative line?
That's a great question. I mean, it kind of comes down to is, what is the person's goals? I mean, if they're, not willing to change their environment, well, they're going to end up on more medications, more supplements, so just trying to figure out, what they're willing to do from changing their lifestyle and then designing it around that. But yeah, definitely teaching, controlling their light environments, teaching about blue blocking glasses. I always tend to have a red light panel on and teach people how to use photobiomodulation, red light devices to kind of help augment, their light exposure, and we get into that, how it improves mitochondrial function. And then really focus on sleep and then nutrition. It's mostly about, seasonal eating, eating, in certain time windows, and then getting enough, DHA in your diet to basically help transmit the energy from your environment to your cells. Those are kind of the big things. And then, I also have a friend who's, an expert in protein metabolism. Your muscles, your metabolic engines, you have to, have healthy muscle. And so they need the right amino acids to help repair themselves. And then, the exercise, yes, as a cardiologist, I'm going to recommend some cardio, but I'm going to really tell you to focus on the resistance training. You need healthy muscles for longevity. Your muscles are what are disposing of the fatty acids, disposing of the glucose. If you want to have healthy cholesterol and healthy blood sugar, you have to have healthy muscles. And so really focusing on those things, and then kind of fixing whatever else the patient is interested in.
I think that's great in terms of the exercise component. At one iteration of my career, I was a personal trainer. I still do some personal training stuff. Kind of like my parents saying, "Hey, get a job, put yourself through massage therapy school," which I wanted to do at one point in life. And so I was a personal trainer, right? And I think it's still this kind of old school mentality that there's exercise that's heart healthy exercise, and there's exercise that's muscle healthy exercise. But really, when you look at it, it really is all working both, but just to what continuum. And I'm a firm believer that resistance training plus high intensity interval training, if it can be accomplished, it kind of gets all world. Just because you're pushing your heart rate up doesn't necessarily mean you're not also recovering down into lower zones and getting a cardiovascular benefit. Or maybe you do some resistance training and then you end it with a nice hike or a jog. I feel like it's too separated. It's not cardiovascular training and resistance training. And if you're going to pick one or the other, pick the resistance training, because it definitely is heart healthy too.
Correct. And it's also, if the name of the game for longevity is, don't die. Well, first, don't have a heart attack. And two, you want to live well. You don't want to live to be old and frail. So, what exercises that help with that? Build up your muscle mass. And so, I probably change up a little bit of my cardio recommendations for most people. Yes, I definitely believe interval training is very, important for many people. But if somebody's just starting out, focus on the resistance strength training, and then I teach them more about kind of zone 2, low and slow exercises where you're just building your mitochondrial base. Your mitochondria are, they do many things, but they're going to burn the fat for energy, and then when they burn, go through their fatty acids, then they got to go, burning through glucose. So you want to teach them to be able to burn fat as efficiently as possible, and that's at a lower heart rate than all-out interval type training. So build up your mitochondrial base with zone 2 training, and then later add the interval training. Especially if you're trying to go for a race or you're trying to be more efficient in your time, then interval training is useful. But focus on doing what the mitochondria need.
What's your take on how can someone assess their mitochondria in terms of I'm just saying, I want to know. I think my mitochondria are doing okay, but what's the best way for me to know that?
That's a great question. I wish there was just one test you could do and be like, yeah, your mitochondria are good or not good. It's kind of, I keep struggling with this. I check a lot of blood work on people and do different testing, and I can't point to one thing like you got good mitochondria or don't. It's a lot of it's listening to their story, how, do they have the literal energy they need to get through the day that they, want to live? Do they sleep well? If they don't sleep well, I already know they're not going to have good mitochondria. If they have, chronic inflammation, very likely their body's not dealing with, that very well. And the immune system is probably, dysregulated in some way. So they probably have, unhealthy mitochondria. But from a cardiovascular way to kind of attest, would be one would be on an echocardiogram. You could sort of look at it as, Yeah, if you had a systolic heart failure where the heart isn't pumping well, you already know that the mitochondria are very, very weak if they can't squeeze. But the main form of heart failure actually is diastolic heart failure. So that's when the heart is relaxing. And it's actually a more energetic process for the heart to relax, where the little muscle actin and myosin fibrils kind of have to relax over each other. That takes a lot of energy. It costs more energy to relax the heart than it does to squeeze the heart. And so there's 4 stages of diastolic dysfunction you can evaluate on an echocardiogram. You can just measure essentially how fast kind of the heart is moving, and that'll tell you essentially how well it's relaxing. And so, I don't know if anybody else has ever thought about this, but yeah, if you have diastolic dysfunction, you have mitochondrial dysfunction. So find a way to improve the mitochondrial function, the diastolic function will improve. In traditional cardiology, all we were ever taught is like diastolic heart failure. Yeah, it's bad, but the only thing you can do is, help control their blood pressure and, give them diuretics to pull off fluid if they have too much fluid on them. But there's no great treatment options. But if you have diastolic dysfunction, you have mitochondrial dysfunction. And then one test that I'm looking to bring into my practice, hopefully in the next quarter or two, is to be able to do a VO2 max assessment where, put somebody on a bike, exercise them until they can't go any longer. But you can essentially see, how much oxygen they can extract from their environment and still make energy in their muscles. And the higher your VO2 max, the more efficient your mitochondria are. And VO2 max is generally pretty well associated with longevity. If you have a very low VO2 max, those are the people that are, going to have poor outcomes, or, they're going to need a heart transplant or potentially a lung transplant, depending if that's the cause why they have low VO2 max. But higher VO2 max, healthier mitochondria. So it's my goal, hopefully, to have it up in the practice in the next couple of months. Test somebody, say your VO2 max is blank, and teach them the exercise routines to help improve that, but also the lifestyle things that we're chatting here about, how to improve mitochondrial function, and then reassess them 3-6 months down the road and see where did the VO2 max go, and say, okay, your mitochondria got 10% better by doing what you've been doing.
And so with that VO2 max test, you're also going to test them at rest to kind of see what their primary or what their balance of Q utilization is. So let's just let everyone know, like when you're just resting, when we're just kind of hanging out like this, we quote unquote should, right, be mostly in fat utilization or have a higher percentage of our body using fat for our fuel source. And then as we increase with intensity, then generally the body says, fat's a great fuel source, but it's a little bit too challenging to burn. It's easier to burn that sugar, that glucose, that glycogen. So it's going to switch over and use that at higher intensities. So I think it would be really fascinating, because if someone knows kind of what their resting fat utilization is, and you can tell them you change these things to improve your mitochondrial function. So that means even if you are sleeping, you're actually going to be a more efficient use fat as a fuel source more efficiently. I think that would be pretty motivating. And then simply saying, okay, well, if you're even at lower intensities, then you're still burning up fat during this time. So that's going to encourage you to go outside and take that walk and go ahead and go into the garage and clean out the garage and do those chores that you wanted to do, mow the yard, rake the yard. Because I think good or bad, using fat as a fuel source is a motivating factor for a lot of people.
For sure. And, people's, goal is body composition optimization. People sometimes think they're over fat, but they're likely under muscled. So work on your muscle mass, because that's going to burn that fat. But ultimately, to get rid of excess body fat, excess is, air quotes here, you have to teach the body to be able to tap into your fat stores. I mean, fat on your body isn't something that, is necessarily a bad thing. I mean, it's evolutionary beneficial that you could store some excess calories to get you through a winter when you didn't have easy access to foods. But you eventually do want to have your body tap into your own fat stores a little bit more. And so, showing them their resting metabolic rate and how much fat versus, carbohydrates they're burning at rest, and then teaching them the ways to try to improve that. Hopefully that would be, like you said, motivating to them to say, okay, I've done the hard work. How much better did I get with that?
Yeah, it helps with patient compliance, I bet. Okay, so this is just going back to that diastolic heart failure, because this is where my brain is going, and I want your take on this. So just in my understanding of like the exclusion zone water, the easy water that I'm so passionate about, in order for something to be in order for a protein configuration to be in a rested state, it has to be full of exclusion zone water, because easy water holds it in its rested structure. And then there is a phase change that happens, and then that rested water melts almost into just bulk fluid water, and that's when the interaction can happen. So you're talking with like the actin and the myosin and how that, and so a failure to relax in my brain goes a failure of enough of the body's ability to make exclusion zone water to be able to put those heart proteins, if you will, those muscle proteins back into their relaxed state in an easy way. And sure, that is definitely a function of mitochondria, because mitochondria help us make that easy water. But that's also then where you're saying, okay, what else makes that exclusion zone water? That's where that infrared comes into handy. That's where the sunlight comes into play, the infrared light from the sun. So does that, I mean, that's just where my brain was at. Does that sound like it could hold true?
I think so. I mean, that'd be amazing. Yeah, how proteins need to be hydrated to be able to unfold properly and to fold properly. So that would be fascinating if I don't know if the studies have ever been done in the States, but is to do an echocardiogram on somebody, take the measurements and then prescribe some type of heliotherapy treatment, ideally, with Mother Nature's sun, but, potentially, what if there was a sauna and like a UVA bulb or something, and then reassess and see, okay, well, they must have made more easy water because, we didn't, give them, an inotrope or different medications to make a difference in the relaxation. Right. So yeah, that's fascinating kind of biohack. I think I would recommend to somebody sometime.
It's just kind of cool. I actually have seen sauna therapy, not with any sort of heart failure, but sauna therapy make an improvement for several people with blood pressure. So I have a feeling that has to do with all the exclusion zone water does play a role in that, I'm sure. Maybe not the primary role, but I think it does play a role in it. Okay, so we talked about sunlight, we talked about exercise, sleep, anything else in this preventive realm? Like, do you recommend set nutrition plans for people, or I mean, I know you personalize things, but do you have like a handful of them that you say, yeah, like I'd like to tweak these variations of eating?
So, I mean, yeah, I'll go down the nutrition rabbit hole in just a second with you. But I'd say some things I also, talk about is not only the sleep, but also just your stress management, to the environment. We talked about more, your mitochondria are sensing the environment, your autonomic nervous system. Are you always in that fight or flight response, or are you able to be in that rest and relaxation phase? And you can measure your heart rate variability with different finger monitors, ear monitors, chest straps, rings. Your heart variability is a good metric of what your body's sensing at that time, how much stress your body's under. If you're an athlete, how recovered are you? You have poor heart rate variability, it's not a day to go set your personal best. You have low heart rate variability, your immune system probably isn't working as well. You're more at risk of any type of infection. So monitor your heart rate variability. I'll tell you, okay, how much you need to push it that day. In my mindset, if I had low HRV, I'd say I need to be outside more, earthing, grounding, more sunlight today to build this back up.
Can I ask you a follow-up on that HRV? Because I think it's really, it's kind of a confusing concept to think, wait, I thought I wanted my heart to just have this really consistent rhythm, boom, boom, boom. And in actuality, what controls heart rate is like this interplay that's going on with your nervous system. So can you explain why we want the heart rate variability to be high?
So, I mean, your sinus node, quote, average heart rate is between 60 and 100. And, your heart is not supposed to be a metronome. So it's not supposed to be, 70, 70, 70, 70, beats a minute. As you breathe in, breathe out, there's different, intrathoracic forces that are going to, pull the vagus nerve in different ways, and you're going to have a beat to beat difference. So as you breathe in, it's out, breathe in, it's contracting. And so your heart rate goes from 70 to 78 to 64. And, that swing, the bigger the swing, that, the healthier the cardiovascular system tends to be. It's a good metric of your exercise ability, how well you're, recovered from previous exercise, how well you've slept, so heart rate variability is a, quick and easy way to measure, the stress that your body's sensing. And you're right, people, what is a resting heart rate that's healthy? Normal, is probably going to be in the 50s and 60s. That would be good autonomic tone. That's, in the average person, yes, there are people, heart rates that low, they're going to be more dizzy, lightheaded, passing out. Okay, that's pathologic at that stage, but a low resting heart rate tends to be a pretty generally high vagal tone. But heart rate variability is a better metric of fitness and essentially longevity.
And immediate, it sounds like immediate stress perception of the body.
Right.
Cool.
It's like the early warning sign that something bad is happening in you.
Yeah. Do you coach up any exercises or anything to help people bring their heart rate variability? Like, have you ever used the HeartMath Institute stuff?
Yeah, that's my go-to thing for people who, aren't already meditators or yoga, people. I said, like, if you need the instant kind of biofeedback, HeartMath is, my go-to. I'm not an instructor for them. I have a couple of their, toys. I played around with them myself, but they clip to your ear. They're measuring your heart rate through, your pulse in your ear, and the little app has a little ball that goes from side to side, and you breathe with it, and that's helping, you train your brain and your heart to be more coherent. If it's in the red zone, you're really out of balance. And when it's in the green, things are more in balance. So you get that immediate feedback. People say, like, well, how long do I do it? I've seen some day, maybe just 5 minutes a day for, 4 to 6 weeks, and you've pretty well kind of entrained your system the way it needs to be. And you don't necessarily need the ear clip on to know how to kind of go into that mode when you need to. Once you know how to kind of breathe properly, or just sense that, like, okay, I know, I'm pretty amped up inside, you're angry sitting around in traffic, you just know how to kind of start pulling that autonomic nervous system a little bit more in balance.
I have played around with that a little bit too, and I find that emotions play a huge role in addition to the breathing and the coordinating. It's like, if I'm thinking of something that makes me really angry, then my heart rate variability is not good. Whereas it can shift like that if all of a sudden I think of love, compassion, joy, just any of those positive emotions. So I really truly think that's I'm sure as a cardiologist you can see. Do you see any patterns in mood or in personality, in terms of, have you noticed anything like that? And I don't want to put you on the spot with your patients or anything like that, but have you noticed anything in terms of people who are switching over from maybe having what looks like a more inflamed cardiovascular system to they're making improvements? Do you notice changes in personality at all?
I don't know so much on personality, and probably not as much in my current practice, where I'm a little bit more niche down to where people are really kind of invested in their health. When I was kind of more of a general cardiologist, and it was anybody who wanted to see me, came in. It kind of trended towards the people who were more angry or had less social support. They tend to have worse outcomes. They tend to have higher blood pressure, and there's definitely data on people presenting to the hospital with heart attacks. The more love and compassion and social support they have, the better outcomes those people have. They tend to recover better.
Wow.
So definitely it's all encompassing. Yeah, we talked about before. Nutrition, exercise, they're important, but if you don't deal with the stress components, the sleep components, you're not going to get the best outcome.
Sure. So let's go nutrition. If you want to do a little bit of a dive into that one.
Sure. So, as you said, I really do try to individualize it. So that's why I said there's no perfect diet for each person. It really depends on their context, and it depends on, their mitochondrial haplotype. So, where's your mom's original mitochondrial lineage from? Kind of idea, how much light versus how much cold your body really needs. And then, talk about, circadian eating. So, eating from sun up to sundown, and then eating, seasonally for where you live in the world. If, sunlight could grow the food outside and you can go pick it off a tree or pick it out of the ground, it's probably okay to eat that time of year. Your surfaces, your eyes, your skin, your gut, lungs, they all have to sense the same thing. And, we both kind of follow the work of Dr. Cruz, his, famous examples, about bananas. Bananas grow in high light cycles, and you put that into your gut, and your skin and your eyes are seeing that it's freezing cold here in St. Louis. Mm-hmm. There's a mismatch of information, and you don't want mismatch of information that drives inflammation. So eating seasonally is extremely important. Getting into the macronutrients, protein is extremely important for, the amino acids that your muscles need. So generally recommend people get, this is almost all comers, but almost everybody needs at least 90 grams of protein or 13 ounces of protein a day just to maintain the muscle mass they have. If they're trying to lay on more muscle mass, they probably need a gram per pound of body weight. Fats, it's going to be a little bit dependent on, their ApoE status and such, but, I'm not, too much of a, stickler on, like, okay, they're eating quite a high fat diet as long as it's, kind of built into the foods. Probably not a big proponent of, throwing it in your, coffee and drinking it, even though, yes, I've done it before, but that's not kind of evolutionary how you would have done things. And then the carbohydrates are somewhat based off your physical activity levels and what is your current kind of glucose tolerance. If you're somebody who's, a very active athlete and can kind of utilize the glucose, you can get away with more of it. But if you're really trying to teach your body how to tap into its own body fat stores, you're going to be lower on that carbohydrate intake. And, we both know that, it's more important than just proteins, fats, and carbohydrates. Your body, is filled up with this easy water and other on their ways. But, if you're still going to kind of focus on the macronutrients, you don't want to, blow it out with, 500 grams of carbohydrates a day. Your body's just going to cause all sorts of reactive oxygen species trying to deal with this food. I mean, atherosclerosis is essentially a postprandial event. When you eat and have to process all this stuff, there's tons of, issues with basically enterotoxins and everything else crossing, the gut barrier, and then your immune system's activated and your blood vessels start getting damaged for the process of it. So, eating less frequent and eating, the proper macronutrients, tends to help the mitochondria do what they need to do, and you don't kind of overcharge them.
Sure. And I think when in doubt, it's like, go back to, if I were to have to go outside and be reliant on finding my own food, what would that look like, right? And I wouldn't be doing it at midnight. And so cutting it off at a certain time. Awesome. Anything else that you want to go into, Dr. Twyman? This has been a fascinating discussion.
I would just ask, what is your experience with people with like earthing and grounding and blood pressure and, thinning of their blood? What have you seen?
So this earthing and grounding has just been a dive for me probably over the past year. So I don't have a ton of client interaction when it comes to that sort of a thing. But so it's not a lot of data points. So not like I can't show you blood before and afters. I can't show you blood pressures. There have been a couple of times where I do feel like grounding. I do a lot of walking sessions with clients outside. Whether it's me with the client or whether we're both talking to each other wherever they are in the world. And it's fascinating going from a client who was really ramped up, on edge, mad about something, to all of a sudden when we start our session to 10 minutes into the session being grounded at their park. It's a completely different individual. So while it's just anecdotal like that, I think that earthing and that grounding is powerful. I think that the earth it's a source of free electrons. And we know that electrons like that, those are nature's antioxidants. And so we think about having to calm inflammation always with food and supplements. Like, well, look, I'm taking this greens powder, or I'm consuming a ton of fish oil, which I don't recommend. So it's like, look, I'm doing things that are anti-inflammatory. And my take is it's free and it's outside and it's instantaneous, because we're dealing with things, we're dealing with quantum particles, we're dealing with electrons. So the effect the experience can be small, but it can be profound. And so I do feel like more and more, just my own personal health, my recommendations for my clients, they seem so new agey woo, but it really, I think that people are becoming more and more cognizant of how impactful these are. They're like, wait a second, you're a nutritionist and you're not recommending set nutrition. It's like, no, not yet. Like, first every morning I want you to see the sunrise. First, I want you to get 45 minutes of grounding. That seems on the research and client experience to do the trick. I want you to block the blue light. And then I want you to make your easy water. Of course, we've got to make our easy water. And then we'll talk nutrition. But in terms of just working with clients on that, that's kind of like where I'm at right now. And I do feel like those are simple but profound things for people to implement into their lives.
That's awesome. And I implement a lot of those in my personal goals to try to live as healthy as I can, and definitely teach my patients that way. And then maybe not today, maybe we'll have to do another one, but I think it'd be interesting to eventually go a little bit more into like the Glycocalyx. I don't think I know enough of it yet to really explain it to patients, other than I think, like little cilia and hairs that's on top of your endothelium. But I think it's fascinating about the idea that, it's negatively charged. I really wonder, is that the source of where like EMFs are actually causing the problem? Like, does it actually cause those things to degrade, and then that's what the problem is?
I think that it very well could be. So that's the heparin sulfate, right? That negatively charged heparin sulfate that attaches to the glycocalyx in the endothelium has that negative charge, and that just readily builds easy. And so does the red blood cell. The surrounding of the red blood cell also readily builds this easy, which I just like people to think of as like a slick gel. So if I wanted stuff to move through a tube, I would want the inside of the tube to be slick, and I would want whatever is moving through the tube to be slick as well. And that's what that easy is. And so we need that negatively charged easy for that to happen. Where am I going with this? Would you remember what you had?
There's EMFs and
yes. So then that's where Dr. Pollack's work comes into play. And I don't know if he's I don't know if a ton is published, but I do remember several anecdotal stories of his with his lab students showing that when they had a computer in the workspace, like in the workspace right next to where they were studying the exclusion zone, that the exclusion zone wouldn't form. So and I also do know that a lot of toxins can, like you said, heavy metals. Does a heavy metal drive up inflammation? Yes, but I'm also a firm believer that heavy metals actually disrupt exclusion zone formation, and that's their main impact. And then also things like glyphosate, pesticides. Also, if anything in the body contains glycine, that glyphosate can get in there, and that's where you can see connective tissue issues. And we know that the blood is basically, it is a connective tissue. And so that's where you can see then disruption of the EZ formation. And again, that will negatively impact the ability of the blood to flow through the blood vessels. And also deplete that negative charge in the body. So if the blood is just carrying this negative charge throughout the system, and we can't get it where it needs to go, and it's creating damage in the meantime, you're creating damage, you're depleting negative charge, you're decharging your battery, if you will, and living a standard American lifestyle with both the way we eat and the indoor way that we live with the toxic lighting. I think it's setting us up for just these depleted bags of easy water and we need to build it back up to really improve everything. It's interesting how that easy water can kind of touch on absolutely all systems and improve their function.
Well, that's awesome. Yeah, I mean, I think that. Yeah.
Cool. Well, so awesome. I love it. It's always great to talk to someone else who appreciates, the kind of like the quantum aspect, the lighting aspect of health. Especially, cardiologist who's looking outside the box. Super cool. I'm excited to continue to follow your work. So I'd love to at some point chat about this again and maybe expand on some of these topics if you're interested. But thank you so much for sharing all of your experience and all of your knowledge. I am just so grateful.
Well, thank you very much for having me. And that was a lot of fun. I don't get to talk to too many people who are as deeply knowledgeable in the quantum world as you are, and who especially who have a nutrition background and don't want to talk to us about fats and calories and such. That information is extremely useful, but you've added on the quantum stuff, and it's just absolutely going to be life changing for your clients. So thank you for the opportunity to speak to your audience, and I look forward to chatting with you in the future about it.
Yeah, absolutely. And hey, if I'm ever in St. Louis, I want to check out your clinic. I want to get some of those tests. I think they're so cool, especially that VO2 stuff. So awesome.
Definitely, it'll be awesome.
Thanks, Dr. Twyman.
Sure, thank you.